Beyond Blame.
Challenging Criminalisation.
For HIV Justice Worldwide.
Coming up in this webinar.
Ending HIV Criminalisation in the context of breastfeeding.
Science, friend or foe? Do scientific advances always help our cause?
Challenges and successes, with reports from the EECA region, Uganda, and the US.
Think global, act local, linking local advocacy with the global, and back again.
And a closing message from Dr. T.
You can post your questions to the panelists either in the Zoom Q&A text box or in the Facebook comments under the live stream. On Twitter, use the hashtags BeyondBlame2021 and HIV Justice.
This webinar is funded through a grant from the Robert Carr Fund.
Please welcome your host, Edwin J. Bernard.
Hello and welcome to Beyond Blame, Challenging Criminalisation for HIV Justice Worldwide. My name is Edwin Bernard and I'm the Executive Director of the HIV Justice Network, a global information and advocacy hub for organisations and activists like you working to end HIV criminalisation. But what do we mean by HIV criminalisation? We're talking about criminal laws or policing that single out people living with HIV in all of our wonderful diversity, making us criminals for acts that wouldn't be crimes if we weren't living with the virus. And it's sometimes assumed that it's only the 101 jurisdictions in 77 countries with HIV-specific criminal laws that are the problem, but more than half of prosecutions take place in countries that use other types of laws to unjustly prosecute people living with HIV. Our most recent analysis indicates that at least 110 countries either have HIV-specific laws or have unjustly applied general laws to people living with HIV for alleged HIV non-disclosure, potential or perceived HIV exposure, or non-malicious, non-intentional HIV transmission. At least 50 countries are currently actively prosecuting individuals under these laws for sexual acts that may or may not risk transmission, as well as for spitting, biting, breastfeeding, and blood donation. And at least another 60 countries have HIV-specific criminal laws without recent reports of active enforcement. And then there's another 20 countries that have used general criminal laws in the past but haven't applied them since at least 2017. Now, we need data and maps like this to understand where HIV criminalisation is a problem. But HIV Justice Worldwide is also about creating tools and building power together to find solutions. The HIV Justice Network is a proud founding member of and secretariat for HIV Justice Worldwide, the global coalition that campaigns to end HIV criminalisation, run by a steering committee comprising global and regional PLHIV networks and human rights organisations. And you'll meet some of the people involved in this work on my virtual sofa in a moment. Now, Beyond Blame is our flagship global meeting. We last met online during the HIV 2020 conference. And the response was so overwhelmingly positive, we thought we'd put on an extra special Eve of World AIDS Day edition for you today, so we can see how far we've come since then and how far we still need to go. So around 300 of you from 60 countries have registered and are here with us today. Although we'll only be speaking English, we have interpretation into French, Russian, and Spanish. And we want to hear from everyone in the chat in any of those languages. If you have questions for me or any of the guests on my virtual sofa, you can either ask them in the Zoom Q&A, or if you're watching live on Facebook, you can place them in the comments under the live stream. We're also keeping an eye on Twitter, so please use the hashtags BeyondBlame2021 and HIV Justice. And after I've talked with all my guests, I'll be handing over to my co-host, Brianna Diaz, to host the Q&A session where we hope to be able to answer as many questions as possible. And now let's start the show by focusing on an issue that really should not be an issue at all: the criminalization of women living with HIV for breastfeeding. Welcome, Alison and Nyasha. It's great to see you. So Nyasha is the program's lead at ARASA, the AIDS and Rights Alliance for Southern Africa, and we'll talk in a moment about why so many breastfeeding cases are taking place in sub-Saharan Africa. But this isn't just happening in Africa. Alison, you're our senior policy analyst here at the HIV Justice Network and leading on this work on behalf of HIV Justice Worldwide. Tell us, why are women living with HIV being prosecuted for breastfeeding, and where is this happening? Alison, you need to unmute yourself.
There we go. First technology mistake. Thank you so much for inviting me today to talk about this important issue. And, you know, I think as a global movement, we've mostly focused on criminalization in the context of sexual exposure. But in the last decade, we've seen an increase in women being charged in relation to breastfeeding. And I think it's really important that as a global movement, we work together to raise awareness about this issue and to stop the prosecutions and punitive responses. So I can tell you that we know of 13 cases. There have been cases in Zimbabwe, Kenya, Malawi, Zambia, Uganda, Botswana, Russia, the United States, and Canada, as far as we know. And 9 of those prosecutions have taken place in Africa since 2013. So this is really raising some alarm bells to us. Women have been charged with various offenses, such as unlawfully doing an act likely to spread a dangerous disease or deliberately infecting another with HIV in relation to breastfeeding an infant. We can talk about the science a bit further along, but we know the risk of transmitting HIV to an infant through breast milk, particularly if a woman is on treatment, is quite low. So we have to assume that these prosecutions come more from an overreaction to an exaggerated threat based on HIV-related stigma, misinformation about HIV transmission, as well as the fact that the burden of preventing transmission to children is placed on the shoulders of women. And we know in many contexts, women are surveilled and judged very harshly for actions related to their children.
Thanks so much, Alison. Now, Nyasha, could you tell us about some of the cases that you're aware of in Southern and Eastern Africa? And I know most of these actually are not of mothers themselves. It's so if you could explain what's been going on, that we'd really need to hear this.
Thank you so much, Edwin, for allowing me on your sofa this evening. So yes, as Alison has said, we know of 9 documented cases in the countries that Alison outlined. And you're right, Edwin, a lot of these cases have been of women who have breastfed or comfort nursed other women's children. And in a few of these cases, and quite a number of these cases, I think in all of the ones in Kenya, these have related to domestic workers. So women who look after children in the home. And I think, you know, as Alison said, what is concerning about this is it tells us a lot about the fact that, you know, whilst there's actually now quite a bit of, I suppose, particularly within the HIV movement itself, an understanding of why criminalization is problematic and does not advance public health and violates human rights. Sometimes this concern is seen as, you know, somewhat different. And what's concerning about this is that it does suggest a moral panic. So in combination to the, you know, stigmatization on the basis of HIV, it is also this panic about the breastfeeding by another. And it is concerning the fact that it does tend to affect women of lower socioeconomic status, women who are generally vulnerable themselves. So the employer-employee dynamic in some of these cases. And it is a little bit reminiscent of what was happening in the earlier days of HIV, when there was a lot of mayhem around particularly domestic workers and transmission of HIV. So it brings back really, not great memories at all around this issue. But I think the point to be made here is that we know the Malawi case in particular made it very clear that the risk of transmission through breastfeeding is very low. And the fact that a lot of the times what happens in these trials, whether they seem to conclusion or not yet, is that there is a lot of bias that actually happens during this trial, which is perpetuated once again by the stigma, the discrimination that is HIV-based, but that is also the panic around, feeding of another's child.
Yeah, thanks, Nyasha. So that Malawi case you're referring to is a case of a woman who's just known as EL, who lives in a very rural community, and I think there's also something to be said about the problem also being around stigma in small villages, and we actually published a feature about the impact of being prosecuted on EL and what happened to her afterwards. And I think Julian will be able to post that in the chat for people to read about it. So what can we do about this? So Nyasha, I know ARASA is working with the African Commission on Human Rights. Tell us about what you're hoping you can achieve there.
Sure, Eden. So this was actually a submission taken to the African Commission, the Committee on HIV, through the Africa-based steering committee members of the HIV Justice Worldwide, so the Southern Africa Litigation Center and ARASA, and is really a request for the Commission to pronounce itself on the issue of HIV criminalization in the context of breastfeeding. The African Commission has already pronounced itself several times on HIV criminalization more broadly, and has, said that, HIV criminalization, overly broad laws should be avoided and given this guidance to states. But we do feel that in this context, the issue of breastfeeding in particular needs to be tackled. So this submission has been placed before the committee through these members, and we are waiting for the Commission to consider this request. Really, the ask has been for a resolution that specifically pronounces on the issues of criminalization in the context of breastfeeding.
Thanks, Nyasha. Now, Alison, today we're launching a brand new section of our HIV Justice Toolkit specifically to help defend people living with HIV who are prosecuted for breastfeeding, chest feeding, or comfort nursing. How important is the science for their defense?
Well, as in all HIV criminalization cases, the science is important, but the science has to go along with human rights arguments. Science out of context, isn't going to get us where we need to be. But just for people who don't know what the science around breastfeeding is showing, the PROMISE study, which is the most commonly cited study, cohort study on HIV transmission through breastfeeding, showed a 0.3% chance of HIV being transmitted to an infant after 6 months of breastfeeding. So that's 3 out of 1,000. Now, we know now that this study represents somewhat of an overestimate of the actual risk of transmission due to various factors in the study. And if women are on treatment throughout their pregnancy and breastfeeding, the risk isn't the same as U equals U, but it's U is close to U. There's always still some HIV in breast milk cells which can be activated, but the risk is really very low. So since most of the criminal statutes are based on exposing someone to a risk or transmitting HIV, understanding that science and how low the risk really is very important to the arguments. So we've included in the toolkit the latest studies, the most recent studies and information on HIV transmission risks, so that those advocating for women or defending women will have that information at their fingertips in order to help with the cases. And I should just add that risk level is based on a woman breastfeeding continually. So an infant takes in quite a bit of milk, breastfeeding every day. So in the cases of comfort nursing that Nyasha mentioned in Africa, that infant didn't necessarily take in any milk. And if they did, it would have been a small amount of milk. So that transmission risk really has to be contextualized to the case from what the actual studies have reported.
Thanks so much, Alison. And we'll be talking more about science later on in the show. Thanks so much for now, Alison Symington and Nyasha Chingore. We'll see you later for the Q&A. So, as we've heard, advances in HIV science can be helpful when used carefully as part of a defense, but do scientific advances always help our cause? So one scientific advance that may well do more harm than good in the context of criminalisation is molecular HIV surveillance. And in October, HIV Justice Worldwide launched a briefing paper to support people living with HIV, activists, legal experts, and human rights campaigners to understand the complexities and consequences of molecular HIV surveillance. To launch the paper, we created a short video that explains the issues and our concerns.
Molecular HIV surveillance, MHS, is a growing research and public health surveillance practice that has concerning implications for human rights. It uses blood samples taken from people living with HIV during routine drug resistance testing and then stores these samples in surveillance databases so that they can be used for public health purposes. Some people consider this to be an exciting new public health tool that can help identify HIV transmission hotspots and ultimately end the epidemic. So why is it that HIV activists are so concerned about this new technology?
Even though molecular HIV surveillance can be a useful public health tool, it's often done unknowingly without consent.
It's been rolled out without any community involvement or engagement.
Surveillance is often linked to the policing of our communities, where Black and Brown people are disproportionately targeted.
When you combine MHS with HIV criminalisation, it's a perfect storm.
Molecular HIV surveillance, MHS for short, is an umbrella term that describes how scientists and public health practitioners analyze the blood samples of people living with HIV to track how the virus is moving between people and populations. MHS can detect patterns of transmitted drug resistance or rates of HIV transmission in a given area, but it can also identify groups of people with similar strains of HIV and link them together. Some scientists and public health folk argue that this approach can be used to link hard-to-reach people to testing, treatment, and care faster than less problematic, tried and trusted methods. But a growing number of human rights activists, including people living with HIV, have deep concerns about the ethics of MHS and believe it may do more harm than good to both public health and human rights.
Our global review revealed many concerns on the practices of MHS, most specifically concerns arising in the context of public health, where data is being collected on people living with HIV without their knowledge or consent as part of a public health surveillance system, and then used to inform public health interventions. This is taking place in countries which actively criminalize sex work, drug use, migration, and HIV, and where data about HIV transmission networks is being shared in unprecedented new ways that is intended to identify people. Sometimes public health institutions will then share their data with researchers who conduct even more analysis on people without their knowledge or consent.
The list of our concerns is long. To name a few, many people do not consent to having their data used in any other way outside of informing their doctor to receive better care. MHS research, public health surveillance, and public health intervention occur without explicit consent from people living with HIV. This means it's increasingly important we have community consultation and engagement to mitigate potential social harms. MHS is frequently applied to already marginalized and criminalized communities. This includes gay and other men who have sex with men, trans women, sex workers, people who use drugs, migrants, and people experiencing houselessness. Public health agencies have historically shared their data with researchers, and funders of this kind of research often require the resulting data to be made public. The issue of trying to prove direct transmission is controversial and is addressed by many researchers with widely varying views. The science behind direct transmission is still contested, and there's concern that such analysis is harmful if it is misused and misunderstood in HIV criminalization cases. In every jurisdiction in the world, even where health privacy laws exist, MHS data, along with other medical records, can always be subpoenaed by a court and used as evidence in criminal investigations or court cases. That means if MHS evidence were included in an investigation or trial, even if the results only inferred that the HIV strain of one person was older than the strain of another, but the limitations of this evidence were not clearly explained and understood, this could actually suffice for a conviction.
Just like with HIV criminalisation, MHS assumes that people living with HIV are solely responsible for HIV prevention, that we're just clusters and targets of public health interventions and not the beneficiaries of public health. We are people, not clusters. We are the public too. And that's why, as global coordinator of the HIV Justice Worldwide Coalition, I commissioned Positive Women's Network USA to produce Molecular HIV Surveillance, a global review of human rights implications, as a first step to understand the problems and to suggest a range of possible solutions.
The main aim of this briefing paper is to help support people living with HIV, activists, legal experts, and human rights campaigners in understanding the complexities and consequences of MHS.
We start with a detailed explanation of what MHS is and then how it is used across the globe, including how the technology works, where it is being conducted, and by whom. The report then describes the growing human rights concerns relating to the use of this technology and goes on to list a number of recommendations for the use of MHS, which were gathered from a survey of international literature and from members of our expert advisory group.
Go to hivjusticeworldwide.org/MHS, where you can download the paper Molecular HIV Surveillance, a global review of human rights implications.
Get others engaged, and not just from the HIV sector, but also from other movements, such as other health areas and the data privacy movement.
Let's start a conversation here, online, or elsewhere. Hashtags #MHS, HIV, HIV Justice, Data Privacy.
And very soon, let's get together and strategize.
Many thanks to Nana Khanna from PWN USA and the paper's co-authors Alexander McClelland and Alfredo Trejo. In the United States, where molecular HIV surveillance is already widely implemented, some researchers, scientists, and public health practitioners have already started taking our concerns seriously. And we want to make sure that other countries learn the lessons of the US and Canada and make sure that any possible public health benefits of molecular HIV surveillance outweigh all of the potential harms, including ensuring absolute data privacy, full legal protections, and social harms prevention. And given the perfect storm of molecular HIV surveillance when combined with criminalisation, we need anyone involved in its implementation to publicly advocate against punitive or coercive laws and policies aimed at people living with HIV to ensure that it's never used in criminal, civil, or immigration investigations or prosecutions. And I'm delighted to announce that today the briefing paper is now also available in French, Russian, and Spanish. Thank you to my colleague Sylvie Beaumont, who's also translating all those languages in the chat, for working so hard to get them ready for today. Some applause for you. But thoughtful and careful use of science can also be helpful to our cause, as we'll find out in a moment. Welcome, Cecile and Kene. Cecile is a senior policy analyst at the HIV Legal Network, and Kene is policy specialist human rights, law and gender at the United Nations Development Programme, UNDP. Welcome to the show. But before we talk, let's just remind ourselves of the power of science, because back in 2018, 20 of the world's leading HIV scientists published an expert consensus statement to address the use of HIV science within the criminal legal system. Since then, it's made a significant impact, supporting HIV criminalisation defence arguments and strategic litigation, as well as shaping advocacy for law and policy reform. So let's hear from some of the biggest names in HIV science about why they wrote the statement and what they hoped it would achieve.
A statement like this, for me, is really necessary, because we found out that not everyone is very well informed where we are in terms of science.
We thought it important to state those facts, to state what we know from a scientific perspective, in order to provide the evidence for the justice system and the legal systems in countries to use it as they wish.
I think we need to bring our science into justice. And we need to be sure that it is understood and that it has the liberating quality that certainly it has had for all of us in the scientific world. It's time for the legal world to understand the current science of HIV.
There is no doubt that this is important knowledge to get out to the broader world. It is our responsibility as people who are immersed in the science to make sure that every sector of the world is aware. And in that way, I believe that people can be treated fairly and equally and justly throughout the world.
So, Cecile, you're working in Canada and across Francophone Africa, and I know in Canada you've been struggling with some problematic, unscientific court rulings for quite some time. Since the statement's been published, have you managed to bring science into justice?
Hello, Edwin. Hello, everyone. Yes, frankly, it has made a big difference. Science is clearly essential, especially in countries like Canada, where really the notion of risk is at the center of prosecution. It's part of the legal test. And in recent years, we've seen a clear evolution in the number of cases in Canada. And for example, in 2020, we know of only one prosecution in Canada. So this is very different from what it used to be. And this is certainly the result of a better understanding of the science around HIV and its transmission, and especially the impact of treatment on prevention. And this is something that the HIV Legal Network, working with scientific experts, have very much contributed to, including by promoting the expert consensus statement for sure. And another element of our strategy to bring science to justice has been to call for the development of guidelines for prosecutors in Canada. Because, changing the law can take time, but at least with sound procedural guidelines, you can try to mitigate the risk of prosecution. And this is, a helpful harm reduction strategy. And after years of advocacy, we finally obtained procedural guidelines, both at the federal level and also at the provincial level. although not across the country. And in all the guidelines, they recognize that people should not be prosecuted if they are on treatment and have an undetectable viral load. Thank you. But we also see some issue with some guidelines, including provincially, where they do not, for example, clearly preclude prosecution when people use condom or have oral sex, even though we know that the risk of transmission there are extremely low. So science is an essential tool, but we cannot just rely on the science to end punitive laws against people living with HIV, because scientific evidence and the way they are interpreted, depend on some underlying consideration that we already talked about today around stigma, discrimination, etc. So it's not enough, and this is why we need to put human rights as well front and center in this fight.
Indeed. Now, Kene, I know that UNDP has developed guidelines for prosecutors. Science plays an important role, but it's certainly not the only one. Can you tell us about those?
Yeah, so thanks, Edwin. UNDP developed this guidance for prosecutors on HIV-related criminal cases. And it was developed as a resource to ensure that HIV-related prosecutions, if and when they occur, are conducted in a fair and objective manner. They are based on the most sound and recent medical and scientific evidence, and that they guarantee the rights and dignity of all the parties to the HIV-related prosecution. And that more also as importantly, that they are grounded in public health. And so this guidance draws from several existing international guidance resources out there and recommendations, including from UNAIDS, UNDP, the Global Commission on HIV and the Law, and other sources that have already recommended a limiting of the use of criminal law in very, very specific instances. But we know that the vast majority of the prosecutions that continue to take place are happening more broadly than these limited circumstances. So given this reality and the complexities that often arise when these legal issues are actually being prosecuted in courts, we thought it would be necessary to develop this global guidance to present a standard that might be applicable to different contexts, different legal systems, different realities and roles of prosecutorial authorities across jurisdictions. And so that's the rationale for this. And as I mentioned earlier, one of the objectives is to make sure that prosecutions, when they occur, are based on the most recent and the most sound medical and scientific evidence.
Absolutely, and those guidelines are, that guidance is so very welcome, Kene. It's already out in English, French and Russian, and I believe Spanish is coming soon. It may also be coming in Arabic. We're still talking about that. But really, that's something that we hope that we can all take up and move forward with. But Cecile, we know that despite the best intentions from both advocates and lawmakers, there can be unintended, unanticipated consequences of focusing only on science as a way to improve the legal environment for people living with HIV. And you've got experience of this in your work in Francophone Africa, haven't you?
Yes, indeed. We have to be really vigilant to ensure that the science is not used against people living with HIV, as we've seen in this scary video about the molecular surveillance. So I've been working for a while now with our Francophone colleagues in Western and Central Africa. And very recently, we were alerted about some legislative reform process happening in Benin. We saw, and we were working on this with UNAIDS, and we saw the bill, and in the bill, even though there were some provision that basically reduced sentencing attached to HIV criminalization. So in a way, the idea was to reduce a little bit the impact of HIV criminalization. We saw another provision providing that people who would be seen as endangering others and who refuse to be on treatment could be forced to be on treatment or could face jail time. So that's a really scary way of using the good stuff about treatment as prevention, again, to punish people living with HIV and to criminalize them. So thankfully, because we were alerted about this bill with the support of HIV Justice Worldwide and our Francophone colleagues from the coalition, we worked together to support and mobilize civil society in Benin around this key population and in Benin. And I have good hopes that we might see this provision out of the bill, but obviously too early to say. But at least it's been a good mobilization there.
Thanks, Cecile. Now, I'm afraid we've run out of time for the moment, so thank you so much, Cecile Kazakskine and Kenny Isom. We'll see you later for the Q&A. Do you have questions for Cecile, for Kenny, or for any of my guests on the virtual sofa? You can ask them in the Zoom Q&A, or if you're watching live on Facebook, you can comment under the live stream. Now, this past year, it's actually the past 2 years, we've been challenged even more than usual, thanks to that other pandemic. And it's been really, really tough, especially for people who are already criminalized or otherwise marginalized. But despite the impact of COVID on our ability to organize and a growing acceptance of punitive approaches to a public health issue, this year, we've also seen some remarkable advocacy in the global movement to end HIV criminalization. Let's hear about some of these successes and remaining challenges now. Welcome, Sveta. So you run a network of amazing women living with HIV across the Eastern Europe and Central Asia region. And I know you've had some successes, but first we have to talk about Russia, the country with the highest number of HIV criminalization cases in the world. In fact, 30% of all reported HIV criminalization cases in 2021 were in Russia, and half of those prosecuted were women. So given the many challenges activists there face, is it still possible to achieve HIV justice?
Thank you, Kevin. Oh, Edwin, sorry. And thank you for your words toward Eurasian Women's Network on AIDS. I really have a privilege and pleasure to work with really amazing women activists, and we really do our best to overcome HIV criminalization and doing community-led and women-led work in Eastern Europe and Central Asia. You ask a really important question about the country with a major prosecution of people living with HIV in context of HIV exposure and HIV transmission. Since 2017, there has been an annual increase in the number of sentences passed in all parts of Article 122 of the Criminal Code of Russian Federation. And unfortunately, compare between 2017 and 2020, the increase in the numbers of sentences passed amounted to more than 50%, from 60 people in 2017 to 94 people in 2020. In general, since 1997 to present day, more than 1,000 convictions have been passed in Russia under Article 120 in the Criminal Code of Russia.
That's unbelievable, really. But hopefully there are ways of supporting advocacy in the country and in the region. Also, if you could speak a little bit louder so that the interpreters can hear you, that would be great. Perhaps you could tell us about some recent successes, for example, at the UN Committee on the Elimination of Discrimination Against Women, CEDAW.
We this September we submitted joint alternative report from Eurasian Women's Network on AIDS and National Organization Women's Network of Women's Community of Kyrgyzstan. And our focus of this alternative report, so-called shadow report, was HIV criminalization and human rights of women living with HIV in Kyrgyzstan. And really unexpectedly, we received a really great recommendation from committee, and first of them, they even have separate division about women living with HIV. And the committee, CEDAW committee, recommends that the state party, in this case Kyrgyzstan, decriminalize the transmission of HIV, Article 149 of the Criminal Code of Kyrgyzstan, through consensual sexual relation between adults. The committee also pay attention on access to health care, including confidential testing, antiretroviral treatment, psychological support. Also, they recommend to prohibit practice of employers requiring HIV certificates for accessing and keeping employment. So for us, it's really a victory, and for our region as well, because Kyrgyzstan, after Tajikistan in 2018, the second country in the region and the second country in Central Asia who received such a great recommendation.
And it's so important to recognize those successes, Sveta, because I know there are many, many challenges. And we wish you all the best and look forward to working with you, or to continue to work with you next year and in the coming years. But for now, thank you so much, Sveta Moroz. We'll see you later for the Q&A.
Thank you.
We know a lot about what's happening in Eastern Europe and Central Asia, in fact, all over the world, because we at the HIV Justice Network continually monitor cases, laws, and advocacy collated into our global HIV criminalization database.
The Global HIV Criminalisation Database is located on HJN's website hivjustice.net. It comprises 3 sections: laws and analyses, cases, and organizations. An overview page introduces the content of the 3 sections and provides a global overview of the available data on a clickable map. Clicking on the text in the pop-up boxes gets you directly to the respective pages. Alternatively, you can go to each section via the main navigation. Laws and Analyses lists known HIV criminalization laws by jurisdiction. It includes a brief overview of how laws have been used, a summary of significant advocacy related to the laws and their use, and, where available, links to the full text of the laws. The interactive map at the bottom of the Laws and Analyses start page lets you visualize which countries and jurisdictions use which kinds of laws in the context of HIV criminalization. The second section is Cases. It provides search tools to access HIV criminalization case reports recorded in the Global HIV Criminalization Database. You can search by keywords, by country, and/or by category, and you can limit search results to specific timeframes. At the bottom of the cases search page, an interactive map lets you visualize by category where we have found case reports for that category. Finally, the third section, Organizations, is a directory of organizations from around the world that are actively working against HIV criminalization and also other intersectional forms of criminalization. The directory only includes organizations that have opted in by asking to be included in the directory. If your organization is not listed and you would like to be included, please fill in this form on the website. The Global HIV Criminalization Database, one of the many advocacy tools available on the website of the HIV Justice Network.
Now, the database is only as good as the data that we input, and as well as media reports, we rely on all of you to tell us what's happening in your country or your region so we can keep it up to date. And the best way of letting us know what's happening and also learning what's happening elsewhere is by joining HIV Justice Worldwide. So why not join the movement and connect with fellow activists through our listserv? You can also email us directly at info@hivjustice.net. Now, let's get on with the show and hear about some more successes and other parts of the world, starting with Uganda. Welcome, Immaculate. So you're the head of advocacy and strategic litigation at the Uganda Network on Law, Ethics and HIV/AIDS, UGANET. And you also serve on 2 International Community of Women Living with HIV ICW boards, ICW East Africa and ICW Global. Amazing to have you with us. Now, I'd love to hear about some success you've had in supporting some recent criminalization cases. I think one's involved breastfeeding or comfort nursing, and another one involved really very unusual accusations targeted at a babysitter living with HIV. Can you tell us how your intervention made a difference?
Okay. Thank you so much, Edwin, and good, hello, everyone, from wherever you are. So the success from Uganda, the 2019 and 2020 was such a bad year for the movement around HIV criminalization. We had a lot of media that was targeting people living with HIV. And some of the cases, one of the cases that I would prefer to call just Sylvia's case. Sylvia was a case that happened in northern Uganda on this young woman who had gone for a visit for just a tour in Kidepo National Park in the northern part of the country. And there she is, she goes with a friend, and on their way, they make a sleepover. And before she knows it, she played with this baby. As she comes back from her tour, she's taken to police cell and over the allegations that she had pricked this baby under the armpit. That was a sad story. It was all over the media. This woman was in a region where she did not understand the language because she's from another region of the country. So every time she applied for bail, she was denied bail on the reason that she's living with HIV, but secondly, that she's not from that part of the country. So she stayed in prison cells for over 7 months until we happened to learn about her story in the newspaper article. And it was a screaming article. Woman infects a baby with HIV. So we rushed in and appealed in the High Court, and it is at High Court where we managed to at least get her. But this had served unfair sentence in the lower court for 7 months. So that is one of the story of the cases that we handled. But the second story is on this young woman that is alleged to have breastfed a baby. And this was just a baby who crawled to her house, and she was seated in the house. And just like any other mother, she picked up the baby and started to play with the baby. And As the mother comes in and finds her playing with the baby, the mother makes an alarm that she's breastfeeding the baby. And the neighbors, the community we live in, the neighbors came. Before she knows it all, she's taken to police. And the first thing under our criminal justice is to test you for HIV. She did not know that she was HIV positive. She just learned on that day. Before she knows it, she's in police cells, and then she's remanded to prison. And we intervened also after seeing this matter in the newspaper, and quickly we managed to get out of bail. So those were two cases that we came across in 2019. But before that, we had Namubiru's case, and this was also another alarming story. Then after that, we have the HIV Prevention and Control Act petition in Parliament. So as for Uganda, 2019, right from 2018, that's Namubiru's case, to where we are at today, HIV criminalization case still coming to our faces. Some have a success, like Sylvia's case is a success, and there is a judgment link that we shared. And others, we are just still in the process. The breastfeeding case is the case of where we got her out on bail. So we are still pursuing it, but we are still really positive that we managed to get those successes, and we're at that level. Yeah.
Yeah, unbelievable. And so thank you for those interventions. But I know you've been challenging the HIV criminalization, forced disclosure and mandatory testing provisions in Uganda's HIV Prevention and Control Act since you launched the campaign in 2016. And finally, your petition is about to be heard. Are you hopeful that the Constitutional Court will make the right decision?
Yes, thank you, Edwin. It has been a very long waiting journey from 2016. We've waited. The courts were silent until this year in August, when finally the case was set for mention. It was exciting. We're like, finally, it sees the eyes of the courtroom. And at that point, we realized that actually government had not responded to our petition, 6 years of being in court. So immediately from our engagement in the courtroom, the judge asked the government to actually respond. And in the response, they quickly came to us and said, we actually want to concede. We see what you're raising in the petition is actually making sense. And we've got government side writing saying that actually what they are raising is not good at all. We do not want to see these sections in the law that criminalizes. So we are seeing light. We are still positive if the government doesn't change in any way from the discussion right now as we go into the issue of having our conferencing notes. We see that government is somehow coming to our side. So it is exciting, and we are at the same time being hopeful that we will see this case come to a conclusion, our petition come to a conclusion, but also a conclusion the right way. And one thing we celebrate here as we start at the introduction is how we bring in HIV science into our HIV petition. In fact, that paper was very, very fundamental in our petition. We had Dr. Paula Mandra, who was one of the writers, give us her affidavit. So we are excited. We believe we've put enough evidence before court, and we believe that this case will come out to the positive that we want. So we are at that stage where really just having that positive feeling, but we hope it all comes to the best.
Yeah. Absolutely, and let's keep that positive vibe going. I hope for your country and for the region, for your neighbour in Kenya, for the whole of the region. I hope that that you're successful in your challenge. You definitely ought to be. You're on the right side of history. So for now, thank you so much, Immaculate Awumsha. We'll see you later for the Q&A. And now let's hear about some remarkable successes in the United States. Welcome, Timothy and Stephen. So Stephen is the Seroproject's Legal Fellow at the AIDS Legal Project of Pennsylvania, and Timothy is Director of Government Relations at AIDS Foundation Chicago. Welcome both. But Timothy, I have to start by congratulating you and the rest of the Illinois HIV Action Alliance for managing to achieve the Holy Grail, total repeal of an HIV-specific criminal law. So I have to ask, how did you do it in a COVID pandemic year, no less? And what lessons can we all learn?
Sure. Thank you so much, Edwin, for having me. And thank you so much for the kudos. I will tell you that the Illinois HIV Action Alliance is a coalition made up of people living with HIV and advocates and activists and community organizations that are really committed to ending the HIV epidemic here in Illinois. And we truly believe that the only way to do that is by addressing HIV-related stigma, discrimination, and criminalization in a very meaningful way. And so when we were discussing, advancing legislation, we looked at potential modernization, but we settled on repeal because, again, HIV is not a crime. And so we felt that we had the political will here, the political capital, if it were, here in Illinois to be able to move that legislation. And so we had two dynamic sponsors, legislative sponsors, and Representative Carol Ammons and Senator Robert Peters that really helped us move it along. And I will tell you, one of the things that we really learned throughout the entire process, and even as the bill has already been signed by Governor Pritzker, is education never stops. Because there is so much misinformation, so much stigma tied to HIV. And so even though the bill has already been signed and enacted, our education will not stop.
So you mentioned State Representative Carol Ammons, and we have a clip of her speaking at the governor's bill signing event in July.
When Tim Jackson called my office and he said, we have this law on the books that criminalizes HIV. I said, really? He said, oh yeah, it's since 1986, it's been on the books, and people with HIV are threatened with this law, and only a few people have been charged with this, and most of them are people of color, and we need to do something about this. So I said, well, send me the information. He did. I immediately read it, and I looked at it, and I said, this has got to be some kind of archaic joke. We don't criminalize STDs or COVID or any other disease that is a public health issue. This is a health issue, yet we have a law on the books that criminalizes people. And so my colleague, Senator Peters, he said, I don't know, Carol, I don't know if we can get it done in the Senate. I tell the truth all the time. It's the truth. We got to tell the truth. We got to tell people how this works so we can get it done. Well, we just happened to have a Black Caucus meeting one night over in Springfield, and who walks in the door but the President of the Senate? And I ain't gonna miss an opportunity. I said, President, we got this thing and we got to do it, and Senator Peters is working hard, and I really need your support to do this. I said, but I'm gonna pass it in the House. And he said, okay. So we did. We passed it in the House, and he kept his word, and he worked with Senator Peters to get it passed in the Senate. That's how this works.
Finally, we're repealing Illinois' archaic HIV criminalization law, the likes of which swept the nation during the earlier years of the AIDS crisis. Research has shown these laws don't decrease infection rates. They don't decrease infection rates, but they do increase stigma. It's high time that we treat HIV as we do other treatable, transmissible diseases, thereby treating our residents with dignity and furthering our mission to end this epidemic in Illinois.
It still brings tears to my eyes, and I've watched that a few times, Timothy. We need to have champions like State Representative Carol Ammons. I mean, amazing, and congratulations again. But Stephen, we should also celebrate the states that have modernized their laws in the US this year. I think Nevada and Virginia. Tell us about what happened there.
Well, one of the things that I'd like to highlight is that one of the things that Timothy hinted at, he had the political landscape for this to work in Illinois, and each state is different. Now, Virginia did not go with a repeal. They decided to enact a different law that has more loopholes, or not loopholes, but more barriers for a prosecutor to jump through if they are to prove their case. As we know, a lot of these statutes that are on the books from the earlier days in the pandemic, intent was never really an issue. Intent was inferred from actually engaging in sexual conduct or conduct believed to transmit the virus. So each state is different. Nevada also passed another statute just so that if a prosecutor is going to actually attempt to move forward with one of these cases, that they have to actually prove all of the elements of the statute, and instead of being afforded the opportunity of making that burden the defendants.
And those two states join Iowa, Colorado, California, North Carolina, Michigan, and Washington, but which is amazing, but there's still many more to go. And I know Zero has been at the forefront of helping to build community capacity, including the remarkable HIV Is Not a Crime Training Academy series, the most recent of which took place online this past summer. Now, this photo was from Indianapolis in 2018, the last in-person meeting, and you can see me in the crowd somewhere there. But Stephen, there's been a huge growth in state organizing, and I think a lot of that's to do with the HINAC academies. Can you tell us about HINAC and perhaps some of the states where there is really great organizing happening?
Absolutely. Well, HINAC is a great opportunity. It stands for HIV Is Not a Crime. It's a national conference where we bring state advocates together, and it's every state has a different landscape, so it kind of feels burdensome that people are doing this on their own. But the revelation that there are people working in. We are currently active in 17 states, Zero, with different advocacy groups. We do strategic planning. We help them move forward. And we ultimately rely on the state advocates to figure out how they want to move forward. Is it a new bill? Is it repeal? What is the best result for your state? And how do the people living with HIV in your state want to move forward? So we do give them a lot of tools and let them figure out what is best for them. In addition to the 17 states that Zero is involved in, I believe there's about 1 or 2 other states that we are aware of their efforts to repeal and or modernize their laws. So there has been just a growing effort in a lot of states, and some states have it easier than others, and that's just the reality of the efforts right now on the ground.
So, Timothy, do you have any tips for people working not only in those other states, but on repeal or modernization around the world?
Yeah, I would say, and Stephen just hinted at it, it's that it's not really very top down. It should be grounded and led by community. He just hinted at a very important point, which is every state is different. And so what we did in Illinois may not work in Virginia or Missouri, which also modernized their law earlier this year too. I saw Tammy put that in the chat, so thank you. And so you have to understand that, and then you have to listen to the people that live in that state that are most impacted. And so that's something that we did here in Illinois, and I think that's something that can be used not only here in the States, but really kind of globally. It's really centering the people most impacted by these laws, and that's people living with HIV.
And if I could just piggyback off of what Timothy just said, it's about listening to the people most impacted. And that's one of the things that a lot of state coalitions have been working for, is the meaningful involvement of people living with HIV in the policy decisions. It's forefront for a lot of people living with HIV that these laws are on the book, but as the state representative in Illinois said, they didn't even know that it existed. So for people living with HIV, it's a major obstacle, but for people not living with HIV, they don't even know it exists. It's very telling. So it has to be the people living with HIV that are most meaningfully affected to change the laws.
Absolutely. Well, for now, though, thank you so much, Stephen Bryson and Timothy Jackson, but we'll see you again very soon for the Q&A. So how can our work at the local level benefit from global guidance and global networks and vice versa? Welcome, Sasha. And unfortunately, we just heard that Laurel is unwell and can't join us today, but I'm sure that Sasha, who's a program manager at the Global Network of People Living with HIV, GMP+, will have plenty to say about linking the global with local and back again. So it's just the two of us, and Laurel, best wishes. Hope you feel better soon.
Yeah, I also hope so. Hi, Edwin. Hi, everyone.
So, Sasha, let's talk first about the global aid strategy and the high-level meeting political declaration, which happened in the summer of this year, and
right.
the specific targets that will help us end HIV criminalization.
So yeah, this year we've got a new global aid strategy and we've got a new political declaration. And in my understanding, actually, it's the best global aid strategy ever, being very frankly speaking. So we have a very good target, which says that less than 10 countries have punitive laws and policy environments that lead to denial or a limitation of services. So we have this 10-10-10, and one part of it speaks very clearly about changing, ending punitive laws and stigma and discrimination. So we have a bit weaker language in a political declaration, but when it comes to that particular part, it's still very strong. So like it names the things, it names like including discriminatory laws and practices that create barriers to reinforce stigma and discrimination, such as aid of consent laws related to HIV non-disclosure, exposure and transmission, those that impose HIV travel restrictions and mandatory testing, and laws that unfairly target people living with and at risk of and affected by HIV. So everything is there. I think for us, as a community decriminalization activist, this 10-10-10 is our aim and instrument at the same time, because that helps us to push to get political will for that change. So,
yeah, I was going to say, I mean, they're pretty ambitious targets. 10% of countries have punitive laws and policies, for example, and we're talking about currently 130. But what is exciting, I think, is that the other part of the political declaration is that the 60% target, that these targets need to be achieved through funding community-led networks and organizations. So this target is 60% of programs should be community-led. Let's talk about that and how do we do it?
Yeah, this is also very remarkable. So it says very clearly what is the percentage which should go to the community-led organizations. And when we're talking about the community-led organizations, it means that it's also including key population networks. It's also about women living with HIV, women from key populations, young people living with HIV, and young key populations. So that is how and they should be led by communities, right? So. This is a very good thing to understand, because it means that we actually can advocate for the funding. We just heard the previous speakers who were saying it have to be grounded, right? This advocacy have to go from the communities. So that's exactly what is the aid strategy and political declaration is saying to us. That is the target we need to reach.
Absolutely. So, Sasha, GMP+, you're the lead, the community lead on the Global Partnership for Action to Eliminate HIV-Related Stigma and Discrimination, which is a partnership between UNAIDS co-sponsors and civil society. And how is this work at the global level making a difference in country?
So basically, global partnership focus on different settings, right? And one of these settings is a justice setting. And what I can say from the experience we had during the last years of implementation, when we were holding the national consultations of people living with HIV and other affected populations, all of them were choosing justice settings, and all of them were choosing reforming the laws and harmful policies. So it is a huge priority for the communities. Also, I can say that the governments who have joined the global partnership and took the obligation to reach, certain progress, they also were choosing, which is a great sign, actually. They all were choosing also justice settings, the majority of them. So that also gives us an opportunity. So global partnership is giving instruments, is giving, clarity how all that should be done, how we should tackle stigma and discrimination. And it also means that governments commit and then will have to report. This is not the only reporting mechanism. We are waiting to have a monitoring and evaluation tool in the beginning of the next year for the guidance for the global partnership, but we are also waiting for the GUM indicators, and we are also waiting for the indicators for the Global Fund, so that we will have the full understanding how the accountability will go, because this is one of the very important mechanisms for the communities. So governments have committed that they will be supporting, together with the donors, together with the UN family, that they will be supporting interventions led by the communities and in justice settings as well. And then we will have to track the progress and see where all that is getting us.
Well, I mean, to be honest, this is a huge success to have this momentum, the global age strategy and the political declaration really pushing us forward, the global partnership. But I have to ask, how do we work with the countries that maybe lack political will?
Well, this is a very good question. Well, first of all, even those countries who have disassociated from the strategy, basically they all have signed for the one of the targets for which is SDG 3. They anyway have to implement that, because this part is actually part of the SDG 3. So even my homeland Russia will have to implement and show some progress around that. I can also say that, again, communities and solidarity is the key, because even in such very complicated countries, what we can see people just who are providing peer-to-peer counseling and saving, women living with HIV from the blackmail, using the criminal article, from the violent situations, just preventing that and supporting each other. That's also one of the ways when you can't change the laws just immediately tomorrow, which can be the case. You still can support each other, and that was what Belarus was as well doing. They have done quite a lot of work before they have managed to change the law. They have done quite a lot of work preventing the cases of criminalization, giving people information, helping them to avoid prison. So that's also can be a way.
Yeah, thank you so much, Alexandra, Sasha, Volgina. Please stay with me as we move on to the Q&A portion of the show. Now, I'd like to invite all of my previous guests to come back on, and I'm going to join you on the virtual sofa as I hand over to my co-host, Brianna Diaz.
Hi, thank you so much, Edwin, and to our many panelists for such an incredible conversation so far on the global effort to end HIV criminalization. Quick reminder that if anyone attending has any more questions, please add them to the question and answer box at the bottom of your Zoom screen, so I can make sure that I am uplifting as many questions as possible during our time together. Should we not be able to respond to your questions today, I'm sure we will follow up in another way, but please get those questions in so I can make sure we answer them. So in our time together, I've heard great questions so far that really unpack some nuances in HIV criminalization efforts that our panelists today are experiencing, as well as themes emerging from our conversation. Some themes I've identified are the need to ensure scientific advances are coupled with human rights, that challenges and successes to decriminalizing HIV across the globe, and ensuring meaningful involvement of people living with HIV and AIDS informs our efforts via building community capacity to lead decriminalization efforts, as well as the intersection of reproductive justice and autonomy and HIV criminalization. A lot to unpack. So quickly, I'm going to start off with a question for Alison and Nyasha, who led our session on ending HIV criminalization in the context of breast and chest feeding. Alison and Nyasha, why are global governmental or non-governmental bodies not considering or taking seriously the new U=U breastfeeding guidance?
Go ahead, Nyasha, or shall I? In terms of U=U and breastfeeding, it seems there isn't really an international consensus yet. What we see is in some countries, guidelines are changing. Those are the medical guidelines in terms of what healthcare providers tell to women living with HIV. And we do see in several countries studies being done, Italy, Switzerland, Germany, the UK, US, to gather more information on the transmission risk. But it isn't a global consensus that U=U in the breastfeeding scenario. It's just changing guidelines in a few places. So there isn't that consensus yet that people can use. But what we are seeing is a lot of evidence evolving and coming out to make a much more robust case. And so hopefully prosecutors will be able to take that into consideration, governments will take that into consideration, and we as a global community can mobilize around the science and the human rights considerations and stop further criminalization of breastfeeding, chest feeding, and comfort nursing.
Excellent. Thank you, Alison. Nyasha, I'm sorry, did you want to follow up before I move on?
I think very quickly to add one thing, at least in the African context, that current recommendations for women living with HIV actually recommend breastfeeding. And I think this is important to note for various reasons, one including the fact that that is what is actually affordable, and kind of when that risk and benefit analysis is done, it sways in actually recommending breastfeeding. And so I do think that this is important for, prosecutions, and the very idea that that then doesn't make sense when the recommendation is that women living with HIV should be breastfeeding, because that is actually what is best for children.
Excellent. Thank you so much for those answers. So, I'm hearing a lot of from those responses that there's lack of consistency in knowledge, data, as well as guidelines to inform, even a local or domestic response, let alone a global. And so from that, I hear, that there is still a lot of challenges to understanding science, as well as the merging of human rights in context of the science that informs our guidelines and campaigns. And so I want to transition to a conversation we had on molecular HIV surveillance, or MHS. And that is a really good example of challenges that science can face folks living with HIV, especially when there is no human rights or MIPA informing its implementation. And so I want to open this question up to all of the panelists. Can you further break down for us, what are community concerns with MHS, and what is a proper response to ensuring that those community concerns are met regarding the implementation of MHS? This is open to all.
Well, if no one else is going to answer, I mean, I think the MHS experts who featured in the video, I think some of them are on the webinar, but I'm not sure they can answer. I mean, I think in our segment we highlighted a lot of the concerns, but I think the one that I didn't mention, and perhaps is the most obvious, is autonomy. Is like, it's our bodies, our choice. Whose blood is it anyway? And I think there's if people living with HIV and the organizations that represent us are not engaged in these complex conversations around how our blood or our data, but our blood in this case, is repurposed. We think we're giving blood in order to understand the best decisions for our treatment, for antiretroviral therapy, understanding resistance, etc. And instead, without us realizing it, it's being used to track the epidemic and treat us as if we are not people anymore, but that we're clusters. And because of the background of HIV criminalization, and the idea that even though it's not really possible to identify who infected whom through science, there's a lot of misunderstanding about it. And when we are engaged in clusters, particularly when the public health at a local level start to follow up on understanding of what's happening, and they actually can figure out who was involved in the cluster, and they can call up someone who's newly diagnosed and say, by the way, did the person that had sex with you, did they disclose their HIV status? And we know that that's been happening for a while in a number of US states. We have it documented for Michigan, for example. So there's a lot of concerns, and we are really worried that it's sort of happening, the idea that everything that happens with science is just magical and always in advance, and it's definitely better. Molecular HIV surveillance is the best way to end the epidemic, and we're not convinced that it is, but if it is a good way, then please engage with us and make sure that we're not treated as just clusters. That's the message.
Absolutely. Thank you so much for that breakdown, Edwin. I hear these concerns with autonomy, as well as, here in the US, I'm most familiar with, as I'm based in the US, is that there's a huge fear in the intersection of HIV crim and molecular HIV surveillance, particularly as it impacts Black, Latinx, Indigenous, and other communities of color. As we know that the coupling of public health and criminalization and tools that support that coupling place our communities at further risk of policing, surveillance, and criminalization. And so, I want to uplift a lot of folks in the chat saying, absolutely, Edwin, we are humans, we're not clusters. Even the way that the terminology we use to talk about this particular tool is harm. And it's further harmed by creating another route to criminalization for folks living with HIV, the potential for it. Kind of touching on that intersection of public health and criminalization, or criminalization used as a response to it. I have a question for Kene. I was wondering if you could talk about COVID-19 laws. We have seen in the US, and I'm sure we've seen globally, the rise in general public health, or even the creation of COVID-19 specific criminalization laws that further place our already marginalized communities at risk. So Kene, can you tell us more about COVID-19 laws and any lessons learned from the HIV movement that can inform advocacy around dismantling these laws?
Thank you so much, Brianna. And you're quite correct on the use of extraordinary legal measures in response to COVID-19. In fact, at the beginning of the pandemic last year, a network of some of our colleagues started seeing similarities in the laws that were coming up before Parliament and in many instances by executive authorities, and how they resembled some of the laws and policies in the early days of HIV, with the panic and the moralization and the myths and everything. And that eventually led actually to an initiative that UNDP leads together with a few other partners, WHO, UNAIDS, the O'Neill Institute. We began to collate these laws. And right now we have about 6,500 pieces of laws and legislation from 194 countries on a database we call the COVID-19 Law Lab. I'll just put the link, the hyperlink in the chat. And we've begun to do analysis of these laws. What do they cover? And we're seeing the use of punitive laws in addition to other issues. And I think there's a lot that's instructive for us here. And it speaks to a number of issues, including the need for us, as we do the work around HIV justice and challenging HIV criminalization, to work with other communities, because this is not a lone fight. We are in the front lines of HIV crim laws, but we see how quickly the machinery resorts to the similar tools when there are other pandemics or issues that are not fully understood. And so it's even disheartening to see that countries that didn't have HIV criminalization laws have criminalized COVID transmission, or now have mandatory requirements around quarantine and violations of COVID-19 restrictions in ways that advocacy stopped it from doing with HIV. And so very easily we can see a slippery slope that could roll back years of advocacy and work around HIV criminalization. So I think it's important to sound the alarm here. That we guard the gains that we've made, however small we think they are, around HIV criminalization. And that secondly, we also build movements together with others outside of the HIV community, so that other actors, whether they be actors working on freedom of expression, civic space, the more active movements around some of the work happening in COVID-19 and other patient groups, that we work with them to share the lessons that we have from 40 years of seeing the law, human rights, and HIV intersect with each other.
Absolutely. I know that this issue touches on folks and all over the globe. Did another panelist want to jump in on their experiences of COVID-19 criminalization and lessons learned from the HIV criminalization efforts?
Thank you so much, Brianna. I would just jump in and say very quickly that that in our movement to advance legislation here in Illinois to end HIV criminalization, that one of the things that actually helped us was this kind of undergirding of people here in Illinois was like, we shouldn't be criminalizing COVID, so we shouldn't be criminalizing HIV too. And so I think kind of that understanding and realization that this is a public health issue, as Representative Emmons said earlier in her piece, that this should be handled such, and criminalizing someone's health status should not be the way that we address a public health issue. And so that's just kind of my thoughts on it.
Sasha?
Yeah, I also wanted to say, the lessons are very clear. It never helps, public health to response to criminalize whatever. It never was. It's just taking people away from the healthcare and making them hiding. And that's the only result we will get. And unfortunately, yes, we saw the cases like in Poland, when all that COVID panic suddenly brought, very bad law about the HIV. I think we have to be really aware of that. I think we have to be very careful. I remember in the beginning of the pandemic, I was working with a journalist from Tajikistan, and she was trying to put this parallel between COVID and HIV, and it wasn't good for both of them, And I was constantly stopping her from doing this, So we have to be really aware, and we have to be careful, and we have to, on every corner, I'm saying, the same thing. For public health, it's not healthy, right? To push people away. That's the only result.
Edwin?
Yeah, just to say, the HIV Justice Worldwide Steering Committee issued a very strong statement right at the very beginning of the COVID pandemic. I think it was March of 2020, warning not to follow in the footsteps of HIV criminalization. And sadly, as Ken has pointed out, a number of countries, many countries, have ignored that. And although he wouldn't name and shame any particular country, I'm going to name and shame South Africa. I mean, South Africa has managed, through incredible advocacy, to never have an HIV-specific criminal law. And last year, it passed a COVID-specific criminal law using the legal precedent in court cases where HIV was transmitted through sexual assault and counted as attempted murder. And so they now have a COVID criminalization law that says if you pass COVID on or you do anything that could pass COVID on, it's attempted murder. I mean, how retrograde is that from a country that has led the continent in so many positive ways around law and policy? And I really hope that things change there for the better.
Absolutely. Like, here for Positive Women's Network USA, we noticed a lot of bills being introduced in the last two legislative sessions that targeted COVID-19 criminalization. For example, in the state of Texas, they actually repealed their HIV criminalization law in 1994. They were the first state to do it. Timothy Jackson being the second to do it in the country, right? Way to set the positive model. But in Texas, they decided to introduce a bill last session that would have criminalized COVID-19. And specifically COVID-19. However, the way that the bill was written, using the term communicable diseases, it would have recriminalized HIV. And so I think it's important that, seasoned folks like us, advocates, lawyers, researchers, academics, and so forth globally, really be on top of the type of policies and legislation that's being introduced where we live to ensure that even these, unintended consequences of criminalization of one particular communicable disease can have a broad and detrimental impact and potentially recriminalize HIV. So that's always fun. I heard also, and Sasha, in your response, you mentioned how there was a lot of media hysteria around COVID-19, and that is something that I'm sure we are all very familiar with in HIV criminalization work. And so I have a question for folks, for our panelists, and please raise your hand so I can make sure to call on you in order. That would be helpful on this issue of media hysteria. We have a question from the chat that says, it's great to see that the UNDP guidance for prosecutors is out. However, there is a separate trial by media that always occurs, right? There are depictions, these depictions by media vilify people living with HIV and can be incredibly inaccurate regarding the risk of HIV transmission. They also inform public opinion and tend to make it more challenging to seek law reform. So this person asks, how can activists change the way the media depicts those accused of HIV exposure? Edwin.
It is a great question, and it's one that has vexed me for many, many years. I started life blogging about this back in 2007 about HIV criminalization. And the first thing that I noticed is how the media reporting really creates a vicious circle of a perpetuation of stigma, discrimination, and more criminalization. A few years ago, HIV Justice Worldwide actually published guidance, a media toolkit on how to work with the media. And it was, of course, again, PWN USA led on that project. It's a fantastic resource. Please go to the Worldwide website, to our toolkit, and find it and read it. There's so much that can be done, but at the same time, in places where there is freedom of the press, it's actually very difficult to prevent them from reporting on some things. One of the problems, of course, is that it tends to be junior court reporters who are assigned to just to report on lower court cases, who end up regurgitating what the prosecutor has said, or even worse, taking press releases from police as kind of fishing expedition. Then, of course, in places where there isn't freedom of the press, perhaps we don't know what's going on, but that's a problem too. So there's a lot more work that needs to be done working with the media, and not just the traditional press and news outlets, but of course social media. I mean, there's a huge amount of problematic misinformation and accusations going on social media that also need to be dealt with. And it's just as we know with all kinds of misinformation, I'm not sure regulation in and of itself is a good idea. Education, education, education.
Stephen.
I think Edwin just stole my thunder on the education aspect. And we know that stigma is a very big barrier for a lot of our advocacy work, and for the way that the media reports on these cases. I mean, as a Black man in America, I'm sure y'all understand that I have no, this is all too often in many communities that I'm a part of. And I just think that we need to get in front of it. Like you said, Edwin, on social media, the fact that this is streaming live on Facebook right now, I'm hoping that it reaches people that can be educated and learn more about it and just get in front of it. I know that here in Pennsylvania, we recently spoke to the Democratic House Policy Committee, and after that, it sparked into a bunch of interviews, and I lended my voice to every opportunity I could. I'm glad that people were putting it on their radar. Let me give you a perspective from our advocacy efforts and let you know that this HIV is not a crime, and I don't know how else to say it.
Immaculate.
Yes, thank you, Sasha. Thank you so much. I just want to share experience of what we are doing around media in Uganda. I must say that for us, all the cases that we've handled, we've got them through media. And from that learning, we decided to make intentional approaches on how do we engage the media. And I see that it is now working. So what we have done right now is to have intentional and targeted cohort of media, from traditional media to online media. And these media guys, we take them through trainings. Every quarter we have different engagements around the media. So the fact that we are drawing cohorts from all channels of media, we are seeing reporting changing. Then the other second approach that we are using recently, it was still last year, we got one of the cases, a media personality. He came out publicly about his HIV status, and the media buzz around him was terrible. So the fact that he was one of them, we are using him as a face to educate the rest of the media. And we are seeing the approaches changing. The way they looked at him then, when he just came out publicly, and the way they are looking at him now, because he's the face that is educating the rest of the media, is kind of shifting. And we believe that in the near future, as we continue to have this continuous engagement with media, the reporting may change. Definitely, there are new crops that come in the media, the young ones, the senior and all that. But I think the more you engage the media, the more you use their own faces, the more you come and try to understand them, where they are coming from in terms of when they are reporting. Do they really appreciate the issues that affect people living with HIV? Do they report with that human face? Kind of touches the issue that they start to rethink how they've been doing things. Yeah.
Thank you, Kene.
Yeah, I just wanted to mention that the guidance for prosecutors also includes two specific principles that touch on this issue: avoidance of sensationalization of cases and protecting the rights of all the concerned parties, including the families of the complainants, the accused persons, for whom these media reports have broader impact and implication. And I also see that in context and in jurisdictions where it is possible, advocates could also request the court to anonymize the names of parties or to even place a gag order on some aspects of case reporting. And these could prove very effective tools to use to curb, to the extent possible, the sensationalization of media reports by media reports.
Thank you. Sasha.
Yeah, also from the experience, I think the first rule is to be very careful. And every time you are giving interviews and you are doing something with media, put a lot of energy into that. Check everything. Be careful. You know, it's really important part of that work. I really love the idea which Yevna is implementing in my region, which is to make a competition for journalists who are writing about HIV and for activists who are writing about HIV. So every year they have winners, those who have made the best article. So that's how you are growing the friendly journalists and how you are growing the new media. Also take advice. We were inviting journalists to our trainings. Take advice from professionals, hear what they are saying, why they're showing it like that. There can be very interesting reasons why they're putting the information in that way. And of course, about the new media, it is challenging. First time I was making for Russia, this Instagram broadcasting, I didn't know which button to push. I'm quite old for that, but I learned myself, I was educating myself how to do that, because this is important. That's how you can get young people. That's how you can get new people who are really sitting there in Instagram and places like that. And especially in the countries, as I said, like Russia, where everything is pretty complicated, use what you have.
Excellent. Thank you so much, everyone. I really appreciate the time you all took to share your personal experience and expertise in decriminalizing HIV. I will now hand it back over to Edwin, but thank you so much.
Thank you so much, Brianna Diaz. So many questions, so little time. But if you've been inspired so far, wait till you hear from our closing speaker. I'm delighted to introduce the UN Special Rapporteur on the Right to Physical and Mental Health, Dr. Tilaleng Mofokeng.
Warm greetings to all of you from South Africa. I'm currently in Johannesburg, and I'm very happy to be with you today to add my voice in challenging HIV criminalization in the strongest terms. In the past 2 hours, we've been informed, saddened, engaged, but also energized and inspired. We share a vision of a world where all of us are free to live our lives fully, to celebrate our sexuality in all our glorious diversity, and to find pleasure and fulfillment throughout our lives. None of this can happen when we are living under constant threat of punitive laws that restrict our freedom, strip away our dignity, and punish us for autonomy, for the very things that make us human, whether that's living with a virus, loving who we love, or breastfeeding our children. The evidence is clear. We know that criminalization is bad for health outcomes on every level. It's bad for our health, our mental health, our sexual health, and our well-being as individuals, and it's definitely bad for public health globally. But now we have a real opportunity to turn the tide. The new Global AIDS Strategy and Political Declaration are unequivocal. The HIV pandemic is driven by inequalities, HIV stigma is real, and criminalization is the distillation of inequality and stigma in the worst forms possible. Let us harness this momentum and focus to drive forward the challenges we want. And I commit myself as the special rapporteur on the right of everyone to the highest attainable standard of physical and mental health to keep advocating. While there is much to celebrate, there is still certainly no shortage of work for us to do. As we have heard, 110 countries still have laws or policies that unjustly criminalize people living with HIV. Yet we know that we can't improve laws with science alone. Yes, of course, the science moves us forward, but it is only when science is applied in ways that respect, protect, and defend human rights that we can achieve our goals. And on the eve of World AIDS Day, with its focus this year on shared responsibility and global solidarity to end inequalities, the work to end HIV criminalization is more important than ever. The time has come, the time is now. We know that we are on the right side of history, so let us say it loud and proud. We can't end HIV without HIV justice worldwide. Thank you.
Thank you, Dr. T, and many thanks to Brianna and to all of the guests on the virtual sofa. If you want to be part of the movement to end HIV criminalization, you can go to the HIV Justice Worldwide website and join the movement. The website is also available in Spanish, French, and Russian. And if you want to know more about HIV criminalization, please visit the HIV Justice Network's website. For those of you who've attended via Zoom, you'll see a link to a survey in your browser after the webinar has ended. And on Facebook, you'll see the link under the live stream. We'd so appreciate your feedback. But now it's time to thank everyone involved in putting this together, starting with our director and producer, Nicholas Feustel. Get a special applause, Nick. And a sincere thank you, merci, gracias, spasiba, to the interpreters, without whom we wouldn't have been able to reach so many of you. And thank you to the small team of volunteers who are recording the interpretation channels. Thank you to everyone on the HIV Justice Worldwide Steering Committee, and of course, to the HIV Justice Network team. And most importantly, thanks to all of you for watching and participating.